Hello everyone and welcome to the Health Hub Show. I am your host Nyambura Kamau. But before that, I want to remind you that we are fully sponsored by DreamWorks Investment Limited Company. And this company is everything you need when it comes to building, when it comes to designs, when it comes to project planning and interior decor. They are here for you. So usisikie aibu ama usisikie ugumu kutufikia. Their contact is just below, and we have a special guest na atakuwa anatuambia what today is about and who she is. So hello and welcome to the show. Please tell them your name.
Thank you. My name is Beatrice. Mimi ni daktari wa meno. I work in level 5 and other some private practices around the time.
Oh, thank you. Nice to know you. As you can see, she looks nice. So leo tunataka kujua about how do I put it? We want to keep your children's smile amazing, great and healthy. Sindio?
Yes.
So about children's dental state, can you tell us the common diseases that zinakuanga ama you've heard of?
Okay, basically in the community, I sometimes work in the community and there are a lot of problems that affect the children, and basically for the dental diseases. And you find that many of our parents, they don't know about these diseases and how they can prevent them when they are young. Because basically we teach that before the first tooth appears in the mouth, the baby should be cleaned the teeth. Like if the tooth is not erupted already, like that is between 6 months from 4 months to 6 months, that is when the first tooth appears in the mouth. So before then, you should be cleaning the gum. Basically, you see when you clean, when the baby breastfeeds, you find that there is a lot of, even when you breastfeeding the baby, the milk has some debris that are left on the gum. So basically, you should take maybe cotton wool and clean the gum. Let's go to the diseases. We can get so many diseases that affect even the gum, even before the teeth erupt. And these diseases, number one, we have acute ulcerative gingivitis. Basically, it's called ANAG, or acute necrotizing ulcerative gingivitis. This is very common in small babies. Like you wake up one day and you find that the baby has a lot of sores in the mouth and it's bleeding. You cannot feed, you cannot even do anything. It's so painful. So you find that that is a very serious disease. That is before the teeth gets eruption. So basically, this ANAG, or acute necrotizing ulcerative gingivitis, it is caused by bacterial influx. Like if the milk, or when you breastfeed the baby, you are giving the baby the milk, or even porridge. Even if when you have not cleaned the gum, so the bacteria, which is called normal flora, burst the wall of the gum, and therefore it brings about the ANAG. So basically, there is a need for preventing that by cleaning the gum. Yes, that is number one diseases. So let's come to when the first teeth come out. Basically, we have to clean the tooth, even if it's one. Yes, you should also use the same gauze or the cotton wool. You can you can use the cotton wool, some water, and wipe every time when the baby is has breastfed or he has eaten something. So you clean the gum and the baby tooth, because you find that we have dental caries, which is cavities, and that is when the teeth become now decalcified. Like I'm talking layman. Let me just explain in Kiswahili or something. Like you see, when you have given the baby milk. This milk has sugar.
Yes, it does.
Or porridge has sugar, or tea, or bread, or maybe now this baby has several teeth in the mouth.
Okay.
So what happens for dental caries is when this baby feeds anything sugary, anything with carbohydrates like let's say bread, cakes, the sweets that they love so much, the biscuits.
True.
So there is this normal flora in the mouth, those bacteria that are for normal good, as in they prevent the mouth from any diseases.
Yeah.
So this normal flora, if you are not cleaning these teeth, they increase in number.
Oh, okay.
And then when they consume the sugar, it produces some acids. These acids decalcifies the tooth. Decalcification means it removes some calcium in the tooth area, in the enamel. Okay. So when the enamel is removed some calcium, it becomes very loose and it can now develop some cavities. Okay. So that is development of cavities. There must be some sugar, there must be some bacteria, and the mouth must be dirty. Or else, even if the mouth are not dirty, you can also get the dental caries because of frequency of the sugar. Yes, the sweets. So basically this one we tell the children when we go to schools to sensitize on dental diseases. We tell them, please, we are not stopping them not to eat,
especially the snacks.
Yes, they must eat snacks, but don't keep them the whole of the day. The frequency of how you take the sweets and the snacking should not be frequent. Maybe when they are feeding, lunchtime, that is when they should eat sweets because they are feeding together sweets with food. One, yes. But now in between the meals, you should not give them snacks or any sweets because now you will maintain the frequency of the sweets. Okay. Yes. So that is number one. Number two, we have seen that one we call anak. Anak can get any other person, even for others, because it's basically because of the influx of the bacteria if you are not cleaning them out. There are so many other diseases that basically the children can get, even for the adults. We also have oral cancers. The children can also have oral cancers because cancer doesn't choose. Oh yeah, it doesn't choose an age. Yes, you can get also squamous cell carcinoma, those ones. So we can get also in babies. Also, we have another thing. Actually, I want to tell the public about the oral thrush. Oral thrush. One morning, you wake up in the morning and find your baby has whitish stuff on the mouth. Oh, I think that's very common. It's very common in the community here, and we have. One morning you get the teeth, not the soft tissue, the tongue, the gum, every other place in the mouth is all white. So this one is viral contagion and it's treatable basically with a drug we call Nystatin oral drops. That is the only drug that you can use, or basically the others that you can use for oral thrush. So please, if the baby has all these diseases, rush them to the hospital. I once found in the chemist some pharmacy tech prescribing oral thrush on a condition that I termed myself as anak. So this is for the public. Please, if the baby develops any condition, please take this baby to the hospital, take them to the dentist. Please stop going to ask for the pharmacy technologist or pharmacist to tell them to give you drugs for the baby, because most of the time you find that they confuse anak and they confuse anak and oral thrush. Oh, okay. Because both they have similar symptoms, because the whole of the mouth is erythematous. It sometimes can be also the whitish thing and all that. So basically, when you give the Nystatin to the patient suffering from anak, it's very, very dangerous. Yes, because this anak is not caused by the the viral is not a viral condition. It is a bacterial condition. So when you're giving Nystatin, then you are not doing it very well. Yes. So another disease we have also for children. Please avoid giving them sharp things. Many a times we are called at night. My baby has been injured on the palate because he was doing homework and the pen, and they start playing and it fails.
And then it breaks.
Then it breaks the palate. Okay. So it's called trauma. Even when they are riding the bicycles, or when they are fighting and playing, they can fall, and then when they fall, they can injure their tissues and all that. So there are so many other diseases that maybe all the diseases that affect the adults, they can also affect
a child.
Children.
Actually, I have come to learn a lot. I didn't know you're supposed to clean a child.
Yes.
But kama meno haijatokea,
yes.
That is
why they get the oral thrush, they also get the anag, and they get all many other conditions.
Yes. Now, before that, maybe I think you should tell us maybe how many times. Like children tumezoea kupeleka clinic after this period. Maybe we should also know the importance and how many times a child should visit a dentist. But before we get the answer, I want to remind everyone out there that you should keep tuned on. This is very important, especially kwanza sahi tuko holiday. It's you and your child right now. So you need to maintain their teeth, you need to maintain their health, especially their oral health. Sahi wanakula everything, right? Sahi wanakula everything. Also, I want to remind you that DreamWorks Investment, they are the people you need when it comes to project management and when it comes to project designing. Do you need an architectural design? Do you need an interior design? They are the people you need, and all you need is to make a call and they will be there. We're just going for a short break. Don't move.